It's Medicare Monday on Community Connection, and Mike Hitcho, the CEO of Hitcho Insurance Agency, is here to educate us a little about the difference between the group coverage many working people are accustomed to versus Medicare and Penny. Mike, as always, thanks for joining us.
Hey, thank you for having me, Liz.
So if someone is going from group health or an individual health plan to Medicare, what are some of the things they'll notice?
Well, they're going to notice that there's a lot more customizable plans available on Medicare. Now, I know I've talked about, just Medicare Supplement or Medicare Advantage plan, but there really entails a lot of different ways to slice and dice this whole pie to figure out what it is that is important to you. What are you going to need for coverage? What do you want? What should you have? What makes sense based off a lot of factors, where you're at now in your life, your family health history, and such. So unlike, if you're working for a carrier, here's 3 different options for group health. Here are the prices. They may or may not be expensive. If you retire and go on the ACA, are you getting a good subsidy and it's covering the whole thing? Or no, you're paying the full rate, $2,000, $3,000 for a couple. I mean, it's out there. So hopefully with Medicare, it's going to lower some of the costs for at least the health insurance. Maybe drug costs go up a little bit, maybe they go down. I don't know, but that's what they're going to see. A lot of different options, which, number one, you want to be working with somebody who has access to all those options. And then number 2 is going to be able to explain and pick the right plan for you.
What else will they see?
Well, they're going to see that Medicare itself does not cover prescription drugs. So, and if you're on drugs now, even if you're not, you're going to want to have coverage. So you're going to find out, they need to get coverage.
So we hear that if you, get penalized, if you enroll late, you can get penalized. So
yeah, you can.
Is that true?
Yes, it is. Now, it depends on the situation. Where we see penalties are people that did not have drug coverage when they were supposed to have drug coverage. And then maybe 1 in 1,000 clients, they just opted not to get Medicare when they were supposed to. But otherwise, if you're working with group insurance through that employer, when you retire, you'll be able to get on without a penalty. But like I said before, you could be penalized for those other reasons.
If someone wants to contact you, how do they do that?
Probably the easiest way, go online, go to our website, send us an email, hitchoins.com is the website. Give us a call, 610-694-9435. Even send us a text. If you're in the area, stop by, say hi.
All right, Mike. Thank you again for joining us on Community Connection.
Thank you, Liz.